Today, the Erie County Health Department released its 111-page report regarding health disparities in the county. It documents the scope and depth of Erie County's health disparities with an equity lens that incorporates social determinants of health. Now, the New York Health Foundation defines health equity as when everyone has the opportunities and resources that they need to be as healthy as possible and that no one is disadvantaged. I spoke with a local primary care physician to go in depth. The report includes sections on race and ethnicity, immigrant and refugee status, gender and sexual identity, and disability status as interconnected and overlapping factors that impact individual health.
Unless you've been on Medicaid, unless you've lived in these communities, unless you live in these housing communities, you don't know what it is to go through and get the services. And unfortunately, that's the only choice in some cases they have.
Dr. Raul Vasquez is a Buffalo primary care physician.
My office is on Jefferson. This is the only primary care office that's on Jefferson because at one point UB Family Medicine pulled out of it. And so we wanted to make sure that that area was not forgotten.
Having been in private practice in the inner city for 27 years, he says an educated patient is imperative to eliminating some of these disparities.
And I work at the University of Buffalo Medical School. I want to see more of us. I sponsor scholarships. The more that people look like them, the more that we're going to change some of these things because they reflect who you are.
The report shows individual behaviors and genetics contribute to about 35% of health outcomes. Social detriments of health, which include economic stability, education access and quality, healthcare access and quality, account for the rest.
Not that we have to get more money, but the money that's already coming in has to be used in a better way to kind of create outcomes. And if you don't deliver on the outcomes, then there should be some accountability. I don't think there's no accountability in the medical field. There's no accountability in the insurance field.
Dr. Vasquez says it's important to look at the data and make it actionable.
You have to have outcomes. You have to show that those numbers in this report are improving. And if they don't, then you shouldn't get paid. I'm sorry to say that.
Now, if you'd like to read the full report, you can head to our website, WKBW.com.